Welcome back. I'm Dr. Jim Devine, downtown Seattle chiropractor, located at 1205 2nd Avenue. Today I'm at Vision Quest Gym in Tacoma, Washington, and I'm going to demonstrate a few techniques that I use for myself and recommend for my patients that have really nasty trigger points or really tender spots that need to be worked out. We've all tried massage. Massage works really well, and I've had a video I did prior to this on foam rollers, and those work really well too. But probably my favorite tool is this little lacrosse ball. It's a $5 ball. It's very hard, like a hard ball. And what I use it for is to work out trigger points that the foam roller just doesn't get to. So today I'm going to demonstrate a few things that have really helped me. First of all, I got some trigger points in some areas that have damage from working out in my upper back and through this area right here. This is where your rotator cuff and also your latissimus dorsi and deltoid attaches right through here, not to mention your triceps. So today what I'm going to do, I'm going to demonstrate some techniques that I use to really help loosen this up, especially before I work out. So first of all, what you want to do is kind of find a surface, flat surface, and get on the ground and basically put that ball where you're most tender at. And then what you want to do is really kind of roll into that. And you can make this as hard as you want. Basically, once you find a spot, what I like to do is kind of actively move my arm up and down to really kind of work that muscle. And this really gets out trigger points, which if left uncorrected, it leads to scar tissue. So basically what I'm doing is kind of working that whole rotator cuff area in my upper arm. And I'll do this for about, 60 to 90 seconds, for as long as I can take it. And I'll kind of find another spot and just kind of move maybe an inch and just kind of really isolate that area and just kind of focus on that and work that out. And again, I'm doing this for about 60 to 90 seconds. Now what I also do, I've got some injuries myself on my front deltoid and my bicep tendon. So what I'll do is I'll basically get the ball again, and I'll lie on the ground and just kind of really work it and kind of work my shoulder into that. I've got my arm behind me, straight, with kind of a fist on the ground. Just kind of work that bicep tendon and anterior deltoid. And if you want, you can kind of really isolate all your weight and kind of put all your weight right on that shoulder. Kind of raise your hips up just a little bit. Now, again, I worked out for about 60 to 90 seconds because it's pretty painful. And then, one of the other common injuries that we see a lot of is people have injuries in the hip flexors. This is where your IT band, your glute minimus attaches here to your IT band, and also where your quadriceps tendon attaches here to the top of your hip. So what I like to do here basically is put that ball right in through here where that sore spot is, and basically find that spot and just kind of roll into it and really kind of isolate that muscle. And again, what that does, it breaks that fibrous scar tissue and just kind of breaks that down, which helps promote blood flow, which aids in the healing process. Just kind of work that back and forth for about, again, 60 to 90 seconds or as long as you can take it. You can also use this here on any other parts of your body, your quads, your glutes, your arm. You can kind of massage in the back of your neck, right where the muscles, your trapezius muscles attached to the base of your skull. Really good to kind of work that also. What I do personally, I keep one of these in my gym bag. I work out 5-6 days a week, and before I work out, I have a warm-up session about 10 minutes, and this is a very important part of my warm-up. We stock these in the office. You can get them on Amazon for I think 3 for 15 bucks. But highly recommended. Yours in good health, Dr. Devine here, signing out.